हाय।
हेलो मैम। गुड इवनिंग।
गुड इवनिंग नम्रता, कैसी हो? हाँ,
ठीक हूँ मैम, आप?
मैं ठीक हूँ। मैं भी जिस दिन वेबिनार होता है उस दिन मुझे जरूर लेट होता है ओपीडी में। मैं क्या करूँ?
क्लिनिक में हो?
हाँ, क्लिनिक में हूँ। और इतनी तेज बारिश हो रही है, मैंने सोचा कितना भी फास्ट जाऊंगी पहुंच ही नहीं पाऊंगी। इससे अच्छा है कि वेबिनार करके जाती हूँ, है ना? हाँ।
हेलो। हाय डॉक्टर
हेलो।
रितु।
हाय मैम, हाउ आर यू?
बस ऑल गुड। आवाज आ रही है ठीक?
हाँ, आवाज ठीक आ रही है। दिख नहीं रहे हो आप लेकिन।
एक सेकेंड एक सेकेंड।
हाँ।
चलिए।
हाँ, दिख गए दिख
हाय।
गए दिख गए। या। हाय। हाँ।
हाय
थैंक यू
सो
फॉर।
हाउ आर यू?
आई एम फाइन फाइन। आप बताओ, आप कैसे हो? हाँ।
बस बिल्कुल बहुत बढ़िया। ऑल गुड।
चलिए। मैम, ये 8:30 पे स्टार्ट करेंगे। और
ठीक
लेटर
है।
ऑन आई विल सेंड यू द रिकॉर्डिंग लिंक एंड ऑल दैट। हाँ, ऑडियंस एंड ऑल दैट डिटेल्स। हाँ।
ठीक है।
और पहले नम्रता है हमारे पास। नम्रता मुझे और आपको इंट्रोड्यूस करेगी, फिर वो मुझे हैंड ओवर कर देगी क्वेश्चंस। तो एज व्हाट वी हैव डिस्कस, वी आर गोइंग टू टेक दैट ओनली। प्लस इफ यू विल रिसीव एनी लाइव क्वेश्चंस, दैट विल बी विजिबल टू यू आल्सो। सो
ओके ओके फाइन। चैट में आ जाएगा, चैट
हाँ।
बॉक्स में आ जाएगा।
जी
ठीक
जी
है।
मैम, जी मैम।
ठीक है।
ठीक है मैम, फिर 2-3 मिनट से बस हो जाते हैं, है ना? हाँ हाँ।
ठीक है जी।
मैं
या
वाइंड अप कर रही हूँ। हाँ
या
हाँ, ओपीडी में। हाँ। ओके ओके।
ऋतु मैम।
हाँ नम्रता। यस यस, स्टार्ट 8:30।
Yes, we are live now.
Yes.
Good evening, everyone. I'm Namrita Madish from MediSage E-Learning Private Limited, a leading platform dedicated to empowering medical professionals through knowledge sharing, expert insights, and digital innovation. And today, I welcome you all to yet an insightful mid-talk on adult vaccinations. And we are honored to have two distinguished speakers with us, Dr. Ritu Santwani and Dr. Deepa Gupta. Dr. Ritu Santwani, a highly respected obstetrician and gynecologist, infertility specialist, and sexologist. Dr. Santwani holds qualifications including MBBS, MD, FECOG, FIAOG, and Art Singapore. She is the founder and CEO of 360 Degree Healthcare Studio, NUHS Singapore, and is recognized among the top 50 influential doctors on social media. Dr. Santwani also serves as the co-founder of NAAN and is a board member of SWWC, bringing a wealth of expertise in women's health. Joining her today is with us is Dr. Deepa Gupta. She is a highly respected figure in the field of community health and obstetrics. Dr. Gupta holds an MBBS, DGO, and FECOG, and currently serves as the chairperson of the Community Health and Public Awareness Subcommittee of AOGD. She is also a member of Safe Motherhood Committee of FOXY, the vice president of IMA East Delhi, and director of Muskan Clinic in Delhi. In addition, she contributes actively as a member of the MTP committee, Shahdara District, Delhi. Experts, we welcome you to the session, and I now request Dr. Ritu to take the session forward. Over to you, ma'am.
Yeah. Thank you, Namrita, and thank you, Medisage, for providing platform for such academic initiatives. So, a very warm welcome to my dearest Dr. Deepa Madam. Madam, really, we are grateful to you that in spite of your busy schedule, you have taken out time for these academic initiatives. These programs are only purely based on the knowledge sharing. So, I know this is on a very short notice. You accepted my invitation, that too to discuss on a very important topic related to adult vaccination. Friends, as we all know that we all are having lot of confusions still, though we are giving lot of vaccines, still there is a lot of confusion in everyone's mind when to give the another dose, whether there are any side effects or what, and we can give the two vaccines together or not. To discuss all this together, we are having today Deepa Madam with us. So let's begin the interactive session. Madam, with your permission, can I start the questions?
Yes, sure, Dr. Ritu. Thank you so much for the opportunity.
Madam, actually, this program is very popular because Medisage is doing a lot of work also.
I know, yeah.
This program is very popular among the PG students also. So we receive lot of questions. Once the program will go, meanwhile, you are able to see lot of questions will start coming in the chat box that Namrata will share with you. So, ma'am, my first question to you, as we are discussing today about the adult vaccination. So, do you think or do you find that there are some myths also related to this adult vaccination?
Yes, you are absolutely right, Dr. Ritu. Actually, there's lots of the adults, whenever the parents come to us or a patient comes to us, especially a female, because we being a gynecologist, when we talk to them about the vaccination, she always thinks कि vaccination तो बच्चों की होती है, बड़ों की तो vaccination कोई होती ही नहीं है. So they think the vaccination is only for the children. But it is important for we clinician to break this myth. But the very much credit to this thing goes to the COVID also.
Correct.
Because when the COVID came, people realized the importance of the vaccine, and then they realized that there are so many diseases which are preventable if we can take vaccines. So a little bit of awareness has started, and I think that today's program will be a very big platform on this vaccination, and it is going to break all the myths. And as we all know, vaccination is the most cost-effective public health intervention. So it not only improves the quality of life, but reduces the mortality and morbidity associated with various preventable diseases. So it becomes very important for us clinicians to do a lot of counseling to the patient regarding the adult vaccination.
Correct, correct. So thank you so much, ma'am. Very rightly you have pointed out. Yes, whenever we start telling about our adult patients about the vaccine, this is the first answer they give. Ma'am, वो तो बच्चों के लिए होता है, हमें क्यों बताया जा रहा है? So, ma'am, now coming to the next very important point, as we know that related to vaccination, there are different protocols. So, as being a gynecologist, you and me both, we see the ladies of all age group, from adolescents to the ladies who are coming to us for the infertility treatment, or those who are getting pregnant, elderly, menopausal women, or in the geriatric age group. So, what do you think, ma'am, that which vaccine, only a rough outline you can share, because I know this is a very huge topic, that which vaccine is usually recommended for the which age group and how it acts, or you can say in the what are the doses.
Yeah, the most important part is we gynecologists are very lucky this way. We see a girl right from the age of 18 years till her menopause, or maybe postmenopausal also. So I think we should never waste an opportunity. Whenever we get an opportunity, if the patient comes for any purpose, any age group, we must talk to them regarding the vaccination, because as we know in pregnancy, now let's start with the pregnancy part. Okay. Pregnancy may previously we used to give only TT, then it moved to TD, now DTaP. Okay, and flu vaccine. So TT, TD, TTaP and flu. So pregnancy में हमें ये vaccinations देनी चाहिए. If a patient comes, a young girl comes to you, तो pre-pregnancy आप counseling कर सकते हो उसके साथ. तो उसमें भी आप a young girl, especially an adolescent also, or a late adolescent girl, then we can talk about the HPV vaccine in her, and then again this DTaP and flu vaccine. If an elderly comes to us, we have flu vaccines, pneumococcal vaccines, and the latest one is Shingrix. Then a postmenopausal patient also comes, so these things comes into that. If we have a postmenopausal lady with chronic illnesses, like she's diabetic or she's hypertensive, so these conditions also, it doesn't mean that you can't take a vaccine. But you people are the more vulnerable to immunocompromised. So flu vaccine, pneumococcal vaccine also comes into that category.
Thank you, ma'am. Ma'am, the questions start coming. Ma'am, I received one question. Already we have discussed that we are going to take this question. Ma'am, this question has come from Dr. Sangeeta Sena. She has joined from Ranchi. So her question is related to hepatitis B vaccination. Ma'am, what are the guidelines for the hepatitis B vaccination? Can we give that in pregnancy, or what are the guidelines? We want to know a little bit detail, because she is saying in my OPD, I am getting a lot of hepatitis B positive patients these days.
See, hepatitis B vaccine should be given to all. That is the universal guideline. And in young, in children, they are giving it very, it's in an immunization schedule. But people, we don't know the hepatitis B vaccine to be given in adults also. If you are not immunized previously, so it can be act as a catch-up vaccination.
Correct.
Yeah. In healthcare workers like us, or a nurse, or paramedics, who is exposed to percutaneous exposure of the skin is there. So they comes into the high risk patients. So hepatitis B vaccination is important in that. Then we comes to like sexually transmitted infections are there. Then in that case is very important to have this hepatitis B, or IV drug abusers, or there's you are in close contact with a hepatitis B positive person. In that case, it should be given. Now we come to the pregnancy part. If a lady has started her hepatitis B vaccination and she conceives, let's take, she's a healthcare worker. Then in pregnancy, we have to complete the dose. Hepatitis B vaccine can be given in pregnancy if it is required. And if it's important, it's risky to her future prospects, so it should be given. Okay. And yeah.
Yeah. Thank you, ma'am. Hopefully, Dr. Sangeeta has got the answer. Yeah. Ma'am, another question we have raised, because I'm taking these questions, what actually we planned to discuss, these already started coming. Ma'am, this question has come in my WhatsApp. This is by Dr. Radha Munshi. She has joined from Akola. Huh? Akola is in Maharashtra, ma'am. Huh? Yeah. So, madam, tell us about the related to flu vaccination in pregnancy, why, and what are the doses?
Flu vaccine should be given in pregnancy.
Yeah.
Ideally, it can be given at any stage,
Yeah.
but we in practice gives it after the 12 weeks.
Yeah.
And flu has got very serious effects on the maternal health. It can lead to ICU admissions. So to decrease the maternal mortality and morbidity, we have to give flu vaccine. We should be given. I mean, it's always an optional for the patient, but we have to always counsel the patient regarding the flu vaccine. So it should be given in pregnancy.
And next question related to this only, the dosage.
Dosage of the
flu
vaccine. Yeah, single dose only.
Yeah.
Single dose is to be given.
Yeah.
And
very rightly, madam has pointed out. So yes, especially in the Maharashtra, because this is the rainy season. So
yes, I wanted to add this thing. Yes.
Yeah.
In Delhi we say, so in Delhi also it's like July, August में. Because normally patients को लगता है कि ये तो सर्दियों में लेनी चाहिए. So it's nothing of that sort. It should be ideally taken from the winter season. And flu, because flu की vaccine भी अगर हम non pregnant भी हैं तो भी हमें हर साल लेनी चाहिए, because उसके वायरस के अपनी म्यूटेशंस होती रहती हैं. सो जो पुरानी आपकी वैक्सीन है वो इतनी इफेक्टिव नहीं रहती है. तो to have a good result, to have a less of the associated problems with the flu, it should be repeated every year. Yeah.
So, Dr. Radha, hopefully you got your answer, as madam has very rightly pointed out. Yes, the flu vaccine can be given anytime. Earlier, the guidelines will say about after the 26 weeks, but now the guidelines have revised that after 14 weeks, anytime we are giving that flu vaccine, and one shot in the pregnancy is sufficient. And even though you are non-pregnant, or we are as a healthcare workers, of course, we also have to take the one vaccine in a year. So, अगर हम अपनी केयर खुद नहीं करेंगे तो हमारी केयर और कौन करेगा? So that is also important. So we have to also take that vaccine. Ma'am, now another question I have received. This is Dr. Mulla. He has joined from Pune only. Acha, he's writing, hello ma'am, how are you? Acha. Yeah, good to that you have joined. Dr. Mulla is writing, madam, as you have just discussed about the Tdap and flu. So if I am practicing in Munchiwada, acha, that is a little slum area. So if my patient is not able to pay for both the vaccines, which vaccine you recommend that I should give, Tdap or flu?
If the patient is not able to afford the two vaccines, so which vaccine should be given?
Yes, he's asking the same because he practices in the slum area. So he's writing ki if patient is affordable, of course I will advise for both. But if my patient, I am seeing practicing in the slum area where most of the patients are totally not affording. So if I have to give one vaccine, which I can give?
That's a very tricky question.
It's
a very tricky question. Yes, we come across such type of patients in our day-to-day practice. So I have no idea about the guidelines regarding this particular thing. But I will say I will give a DTAP to my patient.
Yeah, ma'am, as you very rightly pointed out, so Dr. Mulla, what I suggest कि Tdap तो फिर भी गवर्नमेंट हॉस्पिटल्स में मिल जाता है, फ्लू वैक्सीन तो नहीं मिलता उनको फ्री ऑफ कॉस्ट. So if your patient is afford, give at least the tetanus toxoid vaccine you can give her, or that she can take in the government hospital, and flu vaccine you can give her. So depends. Ideally अगर दोनों देंगे तो अच्छा है.
अच्छा रहेगा. अपने हम लोग प्रैक्टिस में नॉर्मली क्या करते हैं कि ये दोनों के दोनों कंबाइन करके ना, लाइक आई कैन गिव सेम डे आल्सो या कुछ अलग अलग उस पे, तो मैं डिस्काउंट दे देती हूँ पेशेंट को. so that जो affordability का थोड़ा issue आता है तो वो थोड़ा सा उसको आप counteract
कम हो जाए। जी मैम, हाँ, that is also a good suggestion. Yeah. So I have received one question related to, ma'am, just a second, I'm seeing it because a lot of questions have started coming, na? Yeah, ma'am, this is related to this, give some detailed information or about the pneumonia vaccine, because these days we are seeing lot of females are coming and suffering from the pneumonia also.
Yeah, a pneumococcal vaccine you are saying, na?
Yes, ma'am.
Yeah. Because normally pneumococcal vaccine, we always think it's domain of the physician. So it's important that we gynecologist should also know. So PCV13 we give to the patient, and to all the patients it should be given above the age of 50 years ideally. And 1 year के बाद आप उसको PPSV 23 दे सकते हो, ठीक है? लेकिन लेटेस्ट जो है यूएसए में एक PCV20 भी लेटेस्ट आई है, and if you give PCV20 there is no need to give PSV23. So it becomes a single dose.
Okay. Yeah. Thank you so much, ma'am. So what I suggest to my dear friends, yes, what we gynecologists, in which what we are expert, at least we should motivate them for at least that vaccines. As madam has very rightly pointed out, for the pneumococcal, don't hesitate to take one opinion from the physician. So that is what's our domain. We can give the HPV and all other vaccines, flu, DDAP. So that's okay. Yeah. Ma'am, now tell us, if the whole family has some schedule for the traveling, so is it any guidelines that what vaccine they have to take? As we know, yes, for the different countries, so of course there are different guidelines. So what dosage protocol you suggest for these patients?
We need to first ask to them whether the traveling is to international traveling or like in the country only they want to travel. So the international travel vaccines are different, like the yellow fever vaccine of some African countries. So the yellow fever vaccine it's a live attenuated vaccine. Okay.
Correct.
There are dedicated clinics for this particular vaccines, and it's gone most of the time. It's available in the government setup only. But if she's traveling within the country, so she should know what type of exposure she's going to have if she's traveling in our country. So the you never know what type of area you are there, what type of like the flu vaccine becomes important, and another one is typhoid. Because water कैसा है कैसा नहीं है, that also is
correct, ma'am. Very rightly you have pointed out, ma'am. The another question we have received, that which adult vaccines you think that are still underrated in day-to-day practice?
Day-to-day practice. एक तो वही फ्लू वाली बात आ गई है, pneumococcal आ गई है, but the latest has the joined in this thing is Shingrix vaccine. Yeah. Because Shingrix बिल्कुल लेटेस्ट आई है, और नॉर्मली क्या होता है कि एवरीबडी थिंक्स कि जिसको भी चिकन पॉक्स हो चुका है चाइल्डहुड में, तो दे फील कि चिकन पॉक्स तो हमें हो ही गया है, तो अब हमें तो अब मतलब कुछ होगा ही नहीं ऐसा। तो चिकन पॉक्स तो हो गया, लेकिन क्या होता है कि जो चिकन पॉक्स का जो वायरस है वो डॉर्सल न्यूरॉन्स में डोमेंट नॉर्मली पड़ा रहता है, और जैसे इम्यूनिटी कम हुई, लाइक अगर आप एल्डरली आ गए तो इम्यूनिटी आपकी इम्यूनो कॉम्प्रोमाइज्ड है, तो आपको इन दैट केस आपको ये वेरिसेलर जोस्टर वायरस इन्फेक्शन हो सकती है। तो जो शिंगल्स वैक्सीन है, जो शिंग्रिक्स आई है, तो it should be given 50 and above. It should be given, and there are 2 doses, 8 weeks apart, and 8 weeks apart, and it's I know, I agree with you, it's quite a costly vaccine, but it is very, very good, very
costly. Yeah, but to get protection, yes, if you can take, then definitely take it. That is much more better, because अभी इतना ज्यादा देखते हैं हम हर पीस का, So that is much more better for the 50 plus. So definitely it is very good. Now I'm coming to the next question. Just a second. I'm taking because we're receiving a lot of questions. Yeah. Namrata, you can take one or two questions. I am also checking. Ma'am, yeah. What is this cocooning?
Cocooning is basically the vaccination. Flu vaccine is given to the mother we have already given,
Yeah.
especially for the grandparents and the father. Okay.
Okay.
And the caregivers of the baby. So when we vaccinate the people who are taking care of the newborn or who are around the newborns, it will definitely going to provide a very safe environment to the newborn. So that is cocooning.
Yeah, very nice. Very nice.
And DTaP also. We can give DTaP also.
Yeah. Thank you, ma'am. Thank you. Ma'am, we have received one question that which adult vaccines are essential for patients with diabetes and metabolic syndrome?
We have already talked about the elderly vaccines. So the flu, pneumococcal, shingles, these all should be given to the immunocompromised or a diabetic or a hypertensive patient.
As madam has very rightly pointed out, yes, for the diabetic patient, we already know the immunity is less. So yes, of course, the flu vaccine is also important. For Shingrix is also important. Pneumococcal is also important. Depending on the how much your pocket can pay. So
exactly.
So definitely you can take. We advise all the vaccines. Let the patient decide. Ma'am, now some more questions. Namrata, you can take one or two questions, my dear.
Yes, ma'am. Ma'am, the question that we received is, what are the current recommendations for pneumococcal and influenza vaccine in elderly people?
We have already discussed this part.
Yes,
yes.
Yeah.
Pneumococcal vaccine is to be given. And
सेकंड वाला भी ले लिया इसके बाद हम लोग ट्रैवल रिलेटेड भी हो गया मैम.
हो गया है. And how should we handle vaccine in adults with autoimmune conditions who are on long-term immunosuppressants?
They should be given. But live vaccine is to be avoided in this immunocompromised or who are immunosuppressants. Any type of live attenuated vaccine is to be avoided in this case. But otherwise, whatever the vaccines which are important for them, like which are killed vaccines or conjugated vaccines like typhoid, it can be given.
Yeah. So as madam has very rightly pointed out, see, currently I am having one patient, she is suffering from SLE. So she came to me for the infertility treatment. So yes, she also want to take all that vaccines. So I had sent to the internal medicine person to take the one opinion. So that will be much more better. So they told me they had given a letter for that SLE patient that don't give her this flu vaccine because she might be allergic to one or two strains for respiratory.
Okay.
So I just taken out this because in cases of the complicated patients or the patients who in the long-term immunosuppressants, please don't hesitate to take one opinion from the internal medicine or the physician. That will be much more better.
Yeah, it makes you medical legal safe also.
Yes, madam. Yes, yeah. Okay. This already you have taken shingles. Yeah, already we have discussed. Yeah. Ma'am, I think we have taken all this. Ma'am, coming to the very latest guidelines, can you tell us that some, or you have studied something that what are the recent vaccines are in the pipeline?
Yeah, there are some vaccines like
as the respiratory syncytial virus, we know for related to that, there is a lot of research is going on for this RSV vaccine and for the different strains.
Hello. Sorry, वो एकदम से म्यूट हो गया था.
हाँ, no problem.
हाँ. RSV vaccine is there.
हाँ.
You were talking about the newer vaccine, some?
Yes,
Okay,
yes,
okay.
yes,
Yeah,
ma'am.
yeah. Some RSV vaccine has recently come in USA,
हाँ.
but it's not available in India right now. It's for the respiratory syncytial virus infection.
Correct.
It can be given in adults.
Ma'am, next question comes a very practical question, because most of us are having one or the another pet at the home. So if the pet's at the home, so there are some vaccines which are recommended that you have to take, or there are some guidelines related to that.
That's a very good question you have asked, Dr. Ritu. Actually, most of the time people have an impression कि चलो pet को तो vaccinate किया ही हुआ है, तो हमें तो कोई दिक्कत आने नहीं वाली है.
Correct.
Yes, obviously कोई दिक्कत आनी नहीं चाहिए कभी भी किसी को, but pre-exposure prophylaxis is there for the rabies vaccine. So it should be ideally taken, and the 3 doses are given for that, and 0, 7, and 28. The benefit of pre-exposure prophylaxis is like, in case अगर 3 months within taking of the vaccination, 3 months में आपको कोई exposure होता है, तो you don't have to repeat the whole of the schedule of the post prophylaxis this rabies vaccine. And even if there is exposure after the 3 months of taking the pre-exposure vaccines, the dose is very less. And there is no need to give immunoglobulin. Only 2 doses are to be taken, 0 and 3. Okay, post exposure. So it's always good if you can always take pre-exposure prophylaxis of the rabies vaccine. And here I want to point out one thing. If people don't have a thing कि rabies vaccine a pregnancy में कैसे दे सकता है? If a pregnant lady gets exposed to she has a dog bite or something like pet से कुछ भी हुआ है, या any stray dog also, तो prophylaxis post exposure देना ही है with total 5 doses. The important part is her life is more at risk if we don't give her the vaccine. So we don't have to have a second thought कि pregnancy में vaccine या rabies vaccine नहीं देनी. If needed, we have to do it.
Correct. Yeah. Thank you so much, ma'am. Namrata, you can take 1 or 2 last questions, then we'll find out.
Yes, one last question that we have received is, ma'am, what are the recommendations for vaccinating healthcare workers?
For the healthcare workers?
Yes.
देखो, हेल्थ केयर वर्कर्स के लिए तो हेपेटाइटिस बी पे हम सबसे पहले आते हैं, बिकॉज हेपेटाइटिस बी एक्सपोजर उनका काफी ज्यादा है. Then we comes to the flu vaccine, as Dr. Ritu has already discussed, and TTAP also give, and TB की भी vaccines जैसे 10 years पे repeat होती है, तो वो भी important है because needle prick injury का रहता है इसके अंदर. And HPV vaccine तो I think सभी को लेनी है.
Correct. So as madam has very rightly pointed out, yes. So yes, in these days, yes, we are recommending these kind of the vaccines. And for the HPV, we have already taken 2 or 3 sessions just now, means separately.
Yeah, I've tried. Yeah. कि उसको touch ना करें, because we have been always talking much about it.
Yes, ma'am.
So, और एक dedicated session is always needed for HPV.
The HPV, 2 full sessions. So yeah, I think all the questions are finished and we are perfectly on time. So
yeah, let us check anything. Yeah, I think we have covered everything.
Yes, ma'am.
There are no more questions. Yeah.
So thank you, Deepa madam, for taking out your precious time and sharing your immense knowledge with all of us. So with this, we will wind up for today. Over to you, Namrata.
And many congratulations, Dr. Ritu. You are doing such a good work. And thank you so much for including me. Yeah.
Most welcome, ma'am. This is with the cooperation of stalwarts like you and platform providers like Medisage. Those who are always ready, and of course Namrata and Diksha too. Yeah.
We'll meet again for some other talk.
Yes, sure, ma'am. Yeah.
Thank you, Dr. Deepa Gupta and Dr. Ritu Santwani, for an insightful and clinically relevant session on adult vaccination. Your expert perspectives have brought much needed clarity to this complex subject, enriching the understanding of many practicing clinicians. And we deeply appreciate the time and expertise you've shared with MediSage community today. And to our viewers, thank you for joining us. And we hope this Med Talk has enriched your understanding. And don't forget to explore more expert-led sessions on MediSage app. Until next time, thank you.
Namrata, can I have a word right now?
Yes.
Yeah. In September in Delhi, we are doing a Vax Talk, a workshop, pre-conference workshop,
Yes.
only dedicated to vaccination, the adult vaccine.
Yes.
So all the viewers are most welcome to join.
Yes, ma'am.
Thank you.
With this, we'll wind up for today. Bye-bye, everyone. Good night.
Good night.
Good night. Good night.